up, guys? It's Dr. McDaniel. So I wanted to talk today because we've got a couple questions about explaining and understanding the difference between lifts, reductions, with or without implants, what they need specifically. And there's a little bit of misunderstanding in what each surgery's goals are. So with a lift, in my mind at least, the goal of a lift is to reduce and remove skin to keep the same volume of breast tissue, remove skin and make it a tighter envelope. So you're going to be about the same size, just all of that size is going to be consolidated into the lift. With a reduction, the primary goal is to remove skin, but also breast tissue. So you're going to tighten the envelope, but also remove a lot of that volume to make it a smaller breast with a tighter envelope. So they're very different. Now, when do you need an implant versus not needing an implant? I think that depends on your goals. So if you're looking for more cleavage or bust or upper pole fullness, as it's called, you're going to probably need an implant. But there are risks that are involved when you do implants with lifts. And so when it comes to me, I'm going to always put patient safety first, even if that means the patient's willing to take the risk and sign whatever waiver they try to convince me to sign. I'm always going to do it safe. So I sometimes will recommend separating the surgeries and doing either a lift first, because 9 times out of 10, the patient is glad they didn't get the implants because they're happy with the lift. But occasionally they still want more fullness, and then I can come back and put an implant in as soon as 6 months later to give more of that fullness without putting so much risk on the areolar blood perfusion and the nipple surviving with less risk of problems.